Good day. My name is Marius Miguel Vismonte and I am a nursing student from San Beda University, and today I will be demonstrating on how to get the vital signs. The vital signs includes the following. Number 1, we have the temperature, which will be assessed from the axillary. We also have the heart rate, which can either be get from the apical or the radial pulse. And then we also have the respiratory rate, and then the blood pressure, of course. Now, to begin with, we need to introduce ourselves to our patient. So, good day ma'am, my name is Nurse Marius, and today I will be getting your vital signs. Now, the importance of the vital signs is to establish your baseline values, which will be furtherly used in your stay here in the hospital. Now ma'am, before we begin, how may I address you po?
Casey.
Okay ma'am Casey, may I ask you some questions first? Have you been exposed to heat before going here in the hospital?
No.
Okay ma'am, have you been doing some activities before you came here in the hospital?
No.
If that's the case, our patient, Ma'am Casey, is well rested, and now we can begin our vital signs since there are no factors that can alter our results. Now, ma'am, I would like to inform you that all of our equipments and materials that will be used here are well sanitized. So you don't have to worry about being infected. And now, ma'am, I'm going to ask your permission is it okay for you to touch some of your body parts so that we can easily perform our vital signs?
Yes.
Now that we have gotten her permission, we can now begin. We begin our procedure by sanitizing our hands using an alcohol. Ma'am, the first thing that we will be getting is your temperature. In this method po, we will put it under your arms. I'm going to ask you po if you want me to put it in your underarms or you're going to put it po.
I'm going to put it.
Okay, ma'am. Now, while waiting for the temperature of the patient, we can now assess her pulse rate through the radial pulse. In this procedure, we will ask the patient to relax her arms on the table so that we can begin counting. In counting the radial pulse, we need to use our index finger together with our middle finger here in her radial pulse for 1 minute. Okay, Ma'am Casey, may I check your temperature first? So the temperature of our patient is 36.3. Now, after using the thermometer, we are going to set it aside. and then we're going to record the data. So again, her temperature is 36.3 degree Celsius. So Ma'am Casey, your temperature is normal po. And then I've also taken your heart rate through the radial pulse. Your heart rate is 72 BPM, beats per minute, which is normal because the normal value is 60 to 100. And now ma'am, while taking your heart rate, I've also taken your respiratory rate, which is 14 cycles per minute, which is again normal for your age. And now ma'am, we will now proceed to your heart rate again using the apical site. Rest assured ma'am that this stethoscope po is well sanitized. So to begin with, we need to warm the diaphragm of our stethoscope so that the patient won't be shocked. So in locating the apical pulse, it is located in the mid-clavicular on the 5th intercostal space. Ma'am, is it okay if I put it in your chest po?
Yes.
In doing this, we can provide the patient privacy. Ma'am, I'm going to proceed na po. Now we locate the 5th intercostal space and wait for a full minute. Now that we're able to get the patient's apical pulse, we also need to record it. So Ma'am Casey, your apical pulse is 75 BPM, which is close to your radial pulse, which is again normal. Before proceeding to our next procedure, which is the vitals, the blood pressure, we need to ask the patient if she had her blood pressure checked before. So Ma'am Casey, have you been checked with your blood pressure before?
Yes.
If that's the case, Ma'am Casey doesn't need to have her initial BP check. So we can go straight to the procedure. So we need to set aside the equipments that we have used. Ma'am Casey, may I ask your hand? We need to ask the patient to relax her hand. And we need to set up our BP cuff. So ma'am, just like our other materials, this BP app is also sanitized well. So ma'am, relax your arm. So we need to make sure that the BP app is higher than the brachial. And we need to close it well. But we need to make sure that it is not too tight, but still we can insert 2 of our fingers, which is just right. Again, we need to warm our stethoscope. put it on the brachial pulse. Ma'am Casey, I will be beginning to pump now. Okay? We need to make sure that our valve is closed before pumping. So afterwards, we need to again record the data or the blood pressure of our patient. So Ma'am Casey, your blood pressure is 110/80, which is normal again. After that, we need to remove the apparatus. And then we need to ask our patient to rest. So Ma'am Casey, you need to rest po so that we can reassess your vital signs again according to the requirement of the hospital or the clinic or the facility protocols. And then after doing the vital signs, we need to disinfect all the materials that we have used. Let's say for example, the thermometer, we can use the cotton balls and the isopropyl alcohol in the process of disinfection. In disinfecting the thermometer, we start from the top and then around and then going to the bottom. Make sure not touching the tip of the thermometer. And then we need to discard our cotton ball. Now putting it back or back, and then the BP up. We need to clean the diaphragm as well as the earpiece of our stethoscope, and then discard. And then after that, we need to reassess the patient now that she is well rested, and again we need to review the record. So ma'am, again, in summary po of your vital signs, your temperature is 36.3 degrees Celsius, which is normal. Your respiratory rate is 14 cycles per minute, which is again normal. And upon assessment, the rhythm and the depth of your breathing is normal. Also, for your heart rate, the apical is 72 BPM. And then the radial is 75 BPM, which is again normal values for your pulse rate. And then afterwards, we need to provide the aftercare, and then of course, we give thanks to the patient. So again, my name is Marius Miguel, Vismonte, your student nurse. Thank you for watching.